Hi everyone, welcome to our Instagram Live. I'm so excited to have you all with us here today. As many of you know, I live with endometriosis and I work with the team at Endo Warriors. Together we raise awareness and support amazing women dealing with this condition. Today's chat is extra special because we're joined by Curaleaf International to talk about the organisation's new campaign, Painful Conversations, which takes a closer look into women's pain and how we can tackle it head on. I feel it's important we talk openly and honestly with our doctors and others about what works for one and might not work for another. So if you feel like you're out of options, you're not. Medical cannabis is an alternative therapy that's available for eligible women who have tried sufficient numbers of licensed therapies. Curaleaf provides access to pharmaceutical quality cannabis and medical care that's safe and legal. Through empowering women, we want to take back control of health and encourage women to have these painful conversations and seek alternative solutions. I'm joined with a session by the amazing Dr Wendy Holden from the clinic. Hi Wendy.
Hi Candice, very excited to be here today. Slightly nervous with that rocky start, but I'm sure we'll muddle through together, won't we?
I know, I'm so sorry about that. I'm completely new to this. I've never done it before.
Me too.
But every day's a school day. I'll explain a little bit about myself for those online that maybe don't know anything about Endo Warriors or about me personally. So hi, I'm Candice McKenzie. I'm an Endo Warrior, advocate and lived experience volunteer. I'm the co-founder of Endo Warriors based in West Lothian. We're actually one of Scotland's first grassroots organisation to design and empower those awaiting a diagnosis and beyond. For those of you that might not know, endometriosis affects 1 in 10 in those assigned female at birth. That's 1.5 million women across the UK and a staggering 200 million women worldwide. Endometriosis is a chronic inflammatory full body condition with no cure, and it impacts all aspects of my life. It's a cruel and misunderstood condition, but today we're shining a light on endo and the pain management options. Dr Wendy, it is such a pleasure to be chatting with you today about endometriosis and women's pain. Can you tell us a little about your history in medicine, please?
Yes, sure, Candice. So I'm actually not a gynecologist, I'm a rheumatologist by training, and then I've trained additionally in pain management. And I've been working for Curaleaf for about 3 years now. So and I've spoken to hundreds of women with endometriosis now across these 3 years. I've got a slight confession to make, which I was thinking about last night. So when I was first asked to speak to women with endometriosis, I was a little bit daunted, and I must say I had this view, not knowing anything about it at all, that women who had period pain were a little bit flaky. I'm so embarrassed to say that, but it soon became blatantly obvious that it was absolutely not the case at all. So I'm just going to say a little bit about what endometriosis is and the kind of things that people say to me. So endometriosis, as you said, is an inflammatory condition that is not well understood at all. And what happens in this condition is that cells that line the uterus or the womb grow in places where they shouldn't. So in other words, outside the womb. So the cells can be found commonly around the pelvis, on the fallopian tubes, on the ovaries, inside the uterus where it's called adenomyosis, on the bowel, on the bladder, and in some people even more widespread in the brain, sometimes the lung and the diaphragm. And this condition can be absolutely devastating, because what happens is these cells from the lining of the uterus respond to the female hormones in the same way that the lining of the womb does, and they bleed. And obviously, having bleeding in parts of your body where it's not supposed to happen can be incredibly painful. And women typically describe right from the off, when they first have their periods, this pain that is just unmanageable. They can't go to school, they can't compete in sports. Their bowels often go wrong. They have bladder symptoms. I've heard some absolutely hideous stories. You know, I've spoken to lots of women about their stories, and I think one of the worst things that I heard was that a 20-year-old was approached her doctor, and they basically said to her, "What do you want, a menopause or a baby?" So often young women are treated in a pretty appalling way by the medical profession. So in addition, it's not just a painful condition, Candice. As you've said, it affects every aspect of your life. So it can cause cyclical pain, of course, but it can cause more constant pain. It can cause bowel symptoms, bladder symptoms, sleep disturbance, which is a really bad problem for people. Pain that's so bad some women can't walk, vomiting, diarrhea, nausea, migraines also associated with, and many other conditions that go with chronic pain as well. Not to mention the mental health impact. And the knock-on effect on things like relationships. Painful sex is a very common problem, which is not really spoken about at all, I don't think, by medical professionals, probably. All-encompassing condition.
Yeah, yeah, full body. There's no getting away from it, and that's some of the stigmas here at Endo Warriors that we're trying to, crash away, is the fact that it is actually a full body condition.
Yeah.
If it was limited to the pelvis, we'd have better results through hysterectomy. But as a woman sitting here in your presence, I've had a hysterectomy and I still have endometriosis. But one of the things that upsets me about the advocacy side of endometriosis is the kind of, a lot of people in the medical profession would rather say that I no longer have endometriosis because I've had a hysterectomy, but I've had it proven on scans. I've also had several surgeries as a post-hysterectomy woman, so much so that I'm actually being kept in a state of constant menopause because my endometrial cells have migrated out with my pelvis, and the only way for me to manage the endometrial side is to stay on a drug called letrozole, which keeps me, as I said, in a state of menopause. And that's one of the things that I found particularly helpful about finding medical cannabis, was the fact that it also supported my menopausal symptoms while giving me help with the other symptoms associated with the endometriosis. Because while I'm on treatment, it doesn't stop me flaring, it doesn't take the endometriosis away. It's just meant to keep it at a constant stream. But with environmental toxins and everything that's around us, we're never quite 100% sure where the flare has come from. We just know that we've gone into a flare. And the best way for me to handle that is to be on medical cannabis, So it's a very, very, very important topic to discuss, just to give people options as to what is out there other than your generalised therapies, which we'll discuss in greater depth as we work through this call. But yeah, I discovered medical cannabis because I genuinely reached a stalemate in my pain management options. My circumstances become far more complicated after, obviously, my hysterectomy and the removal of my reproductive organs. I have tried and I have been on gabapentin, pregabalin and amitriptyline. And those three drugs, while controlled measures, caused me the most horrendous side effects, personally, speaking from a lived experience perspective. And they made me non-functional, I wasn't the woman that I was. They caused horrendous side effects, from feeling nauseous to feeling drunk. And I don't even drink, making you feel very tired and fatigued at your work. Now, just because that size didn't fit me doesn't mean to say that it doesn't fit everybody else. But I think it's important that we recognise that we're all different and we all have, different requirements. And certainly my receptors are very much aware of my medical cannabis medication, and they have responded beautifully to it. Hence the reason why I'm such a passionate advocate for people having options like this. So yeah, I'll just move on. Could you talk to us a little bit about medical cannabis and the way it helps quality of life for women living with endometriosis? Why should they consider it as an option, when other mainstream therapies maybe haven't worked?
Yeah, that's a great question. So the first thing that's really important to say is that medical cannabis is not a first line option for anybody, of course. And what we would normally need is for women to have tried a couple of other things first. But the vast majority of women will already have been prescribed various medications, hormonal treatments or hormone blockers, anti-inflammatories, and as you said, pregabalin, gabapentin, amitriptyline, anti-inflammatories. So most women will have been prescribed lots and lots of different medicines by the time they come to speak to us at Curaleaf. And the other important thing to say is that this is not a medicine that works for everyone. However, it is another option. So the way that we think of this really is that cannabis is a kind of herbal remedy, really, if you like. So to think of it as a natural remedy, it's a plant that's been used for thousands of years for pain and sleep and anxiety, for example. And it's been legal to prescribe medical cannabis since 2018 for painful conditions, but unfortunately not yet available on the NHS. So the kind of symptoms that patients have said to me that cannabis can help with, I should say how people discover cannabis is often that they've tried it socially or obviously illegally, or they may have been to Amsterdam or America where they've been able to get some medical cannabis legally. And what people say to me is that often it's been the only thing that's helped them with their symptoms. So it can help with the acute pain or the acute pain, which usually comes with bleeding or with ovulation. It can certainly help with nausea or vomiting that goes around that time as well. Many people find that it can be useful for sleep, and it can certainly have an influence on the bladder and the bowel dysfunction that goes wrong around that time as well. In addition, many women say that cannabis can be very calming, so it can allow them to get some control over the most terrible side of their pain, and it can enable them to continue functioning and stay working.
Yeah, I completely agree with everything you said there. Personally, for me, I have a lot of problems with my bowel in respect of transit and various other things. Now, I received surgery just 2 years ago to remove my bowel, which was hung up inside my abdominal cavity, and it had affected my sigmoid colon severely. I ended up with a colorectal surgeon again, as a postmenopausal woman who should no longer have endometriosis. So a lot of the time when I was dealing with transit pain, it was exactly as you described. The nausea and vomiting was a lot. It was profuse. And I remember sitting trying to think, am I going to make it to my work today? Do you know what I mean? And that's at that point, that's when I reach for my mighty vape, and I'll have a vape of my flower, because obviously I've got several strains that I use with my prescription. I've got my oils that I use twice a day, once in the morning, once at night. We both know they're reasonably slow release. And then as your backup, you've got your flower that you can use, which you just put inside a very small metal capsule container that sits inside the mighty vape. And without a word of a lie, within a couple of minutes of using the vape, the nausea, the need to vomit, everything just calms down, and it's enough for you to be able to get yourself dressed and out the door, to continue with your responsibilities, because that's something that we all need to be aware of. We don't have the luxury all the time of being in the house or being off sick. We have got things to do, and we need a medication that's going to support that in order for us to have some semblance of quality of life. So for me, that's what I've personally found with my medical cannabis prescription, is it has definitely aided in my quality of life, shall we say. But there's other conditions that medical cannabis can equally support as well, Dr. Wendy. Would you like to give us a little idea? Obviously, I've got fibromyalgia and diagnosed with hormonal lupus. So for me, my medical cannabis covers a trio of different inflammatory conditions.
Yeah, absolutely. And I want to talk a bit more about how we deliver medical cannabis again in a little while. But you're absolutely right, Candice, that many women who have endometriosis pain also have a lot of other chronic conditions. So, for example, fibromyalgia, which is a chronic pain condition associated with bad sleep. EDS, which is joint hypermobility. A lot of people with EDS have endometriosis as well. Many women with endometriosis have been through all sorts of medical procedures, had quite a lot of bad experiences at the hands of medical professionals, unfortunately. Many of them have been diagnosed quite wrongly with personality disorder, for example, because they've had the temerity to go to the doctor and complain of pain over the years. And many women suffer with a lot of anxiety and depression that goes with chronic pain, and having their lives taken away from them. So medical cannabis can help with quite a few of those different issues as well. So now, in terms of how we can deliver medical cannabis, I should say a little bit about the plant, the constituents of the plant. So in our body, we already have something called the endocannabinoid system, and that is our body's own natural set of receptors that are ready to respond to the cannabis plant, if you like. And the endocannabinoid system controls all sorts of things throughout the body, things like mood, pain, appetite, sleep, hormones, many different systems of the body are involved in the endocannabinoid system. And I think that's possibly why cannabis medicines are so helpful for across all of these different conditions, because it's got a very wide-ranging effect. We can prescribe medical cannabis in two main ways. There are other ways, but the two main ones that people will know about are inhaled cannabis, which, as you said, Candice, is not smoked. It's still illegal to smoke medical cannabis, but it's done through a process called dry vaporizing, which involves warming up the cannabis to the right temperature and heating through a vaporizer, dry vaporizer, and then inhaling the vapor once it's at the right temperature. And as you said, that works extremely quickly. So if you have a panic attack, or if you have one of those kick you in the stomach pain attacks that women with endometriosis get, it will help with that, but then it will wear off. So it's quick to work, but then it wears off in a couple of hours. So what we have for the gap in the pain management and for sleep are cannabis oils, and these go under the tongue, and they're held under the tongue. They're absorbed in the mouth, and they are slow to work, take an hour or so to work, and then once they're in, they stay in much longer, and they will gradually fade. So those can be extremely useful for sleep and for background pain that many women have. The other thing I need to say about the cannabis products is what is in them. So there are lots of different things called terpenes in cannabis, and those are the substances that give it its smell. The two best known ones are CBD and the other one THC, and we use both of those things in our medical products.
Yeah. And am I correct in thinking it's actually really important for those two elements to come together to get the best result
That's
from
exactly
the medication?
right. That's exactly right. So many people will have tried over-the-counter CBD, which sometimes works, but often does not. So CBD combined with THC are usually required for maximum pain relief and anti-inflammatory and anti-anxiety benefits. Yeah, absolutely.
Yeah, that's been my experience as well. Before I found you guys, I did try and buy, over-the-counter CBD, and it wasn't giving me the result that I was aiming for. And it wasn't until I obviously found yourself, so I went through the eligibility criteria and was approved, that I realised there was a major difference between the one element versus the two elements coming together. It made such a huge difference to my pain management, and effectively gave me additional tools in my toolkit just to try and get through a day,
Yeah.
Something I want to talk about as well, because there's such a stigma around medical cannabis, and people are still under the impression that we're stoned, and as I sit here to you now, I am not stoned. I have been on medical cannabis for over 2 years. I run a profitable business. We run a support group, and I'd like you to kind of break down the barriers here and talk a little bit about the stoned influence.
Yeah. Obviously, there is still a stigma around it. Many doctors don't understand medical cannabis at all. It's a totally different language to the language that doctors are used to speaking. It's not something that's taught yet at medical schools. So there's a lot of misunderstanding about this. Obviously, cannabis can be an addictive medication like any other, but much less so than other things that are commonly prescribed, for example, tramadol or pregabalin or alcohol indeed. So what we do at Curaleaf is to very carefully screen patients to make sure the medicine is safe for them. And we would not be prescribing to anyone where we had any concerns that there might be any dependence issues. What we're not talking about here is getting stoned at all. Nobody with endometriosis is using medical cannabis to get stoned. The doses we use are much lower than you would need for a start, and people are just literally using it like a medicine to get through their day. So the doses we use will not have that effect.
Yeah, I completely agree with that. There's also a duty of care that Curaleaf International bring with the prescription as well, because you get checkups every 3 months with your doctor. They discuss how you're feeling on your treatment, whether your treatment is in fact working for you or perhaps not. And I think it's really important to know that you're fully supported when you join the Curaleaf family in respect of your pain management and whether you're getting results from your prescription. And again, I just want to stress the fact that I'm coming from a lived experience perspective here. So everything that I'm talking about is to do with my experience of medical cannabis. And while CBD might suit suit some people, and that's absolutely fine. For me personally, I didn't get a response from CBD on its own. I'm just watching some of the comments coming in here, so I just wanted to respond quickly to something that flashed on the screen. I personally remember feeling really reluctant in speaking to my friends, some of my family in particular. Yeah, very much so. Again, back to the stigma that I undertook my own research, and that's why my face lit up when you started speaking about receptors and things like that, because we carry a lot of receptors down in our pelvis. So when you're talking about endometriosis and you have options to alternative therapies like medical cannabis, it can have a positive impact on the journey of an endo warrior. But yes, I did look for advice, and I did want to find out a little bit more about it, and I did find speaking to my GP really quite challenging, almost like I had actually been prejudged in my appointment, which between you and I, Dr. Wendy, did have a little bit of an impact on my mental health when I left the appointment that day, because I just felt a little icky, as if, oh, you know what they're saying about me now that I've left. But I'm absolutely passionate about the fact that everybody deserves an option, and I don't want to be judged by a doctor. I want them to have my best interest at heart, you know. So it's something that I think with awareness we'll work our way through, and hopefully more doctors will be more open to the benefits that medical cannabis can bring as an alternative therapy.
I agree, and I think at Curaleaf you don't actually have to go through your GP, so you don't need a referral to get an appointment. You can refer yourself. I mean, however, we would always communicate with GPs, and I think you're right, Candice, that the more GPs get to know about this through their patients using medical cannabis, and the more they see that the prescriptions for opiates and other drugs are going down, which they definitely do, then the more they will be interested in this and hopefully start to point people in the right direction.
Yeah, I couldn't agree more. Coming back obviously to female pain management in connection with conditions such as endometriosis, would you would be open to prescribing medical cannabis like we discussed to those with fibromyalgia? So if we had some patients on today experiencing secondary fibromyalgia, they could effectively reach out and see if they've got eligibility.
Absolutely, and I've discovered sort of the other way round, because I see a lot of people with fibromyalgia through my work and through Curaleaf, and as part of that, I'm now asking them, do they think they've got endometriosis? And many of them do. So absolutely, yeah. Many other conditions that are amenable.
Yeah, it's an umbrella condition as well, endometriosis. And it's not till you actually start experiencing your journey you start to realise that you've not just got you've got A, B, and C going on, and it's trying to understand what signals your body's giving you. But the majority of the time for me, it's always been inflammatory. It's always been an inflammatory problem. If I can get the inflammation at bay, I can almost control, you know, the other aspects of my, you know, my inflammatory chronic life as such.
Yep, absolutely. So what should we say to people then that are nervous of taking the plunge? What advice should we give them?
I would say you don't know till you try. Do you know what I mean? And it's like we've said, it might not work for you, but it's definitely worth giving an opportunity, give it a try, because what's your other options? Your other options is to stick on what you've got that might not be agreeing with you, could be interfering with your daily life. And at the end of the day, it's a plant, you know, and it's been dealt with in a controlled measure environment, almost a form of microdosing. So I would implore people to give it a try. Why not? And if you don't like it, don't go back to it, you know. But at least you can say, well, give it a shot.
Absolutely, thank you. And here's our website in the back, Curaleaf. If anyone wants any more information on the topic, come and have a look at our website, and maybe see you soon in the clinic.